What the Study Says.
Welcome back to What the Study Says. I'm Dr. Kai.
And I'm Dr. May.
So let's talk protein. You've probably heard the whispers, right? Maybe even seen those clickbait headlines. Too much protein will wreck your kidneys.
Oh, yeah. That one's everywhere.
It really is. It pops up constantly, especially if you're, trying to build muscle, lose weight, or even just eat a bit healthier. I remember thinking about it myself. Is that extra scoop of protein powder really putting my kidneys on notice?
It's a huge concern for people. And it kind of makes sense on the surface, doesn't it? Kidneys filter waste, protein metabolism creates waste. So more protein, more work.
Exactly. But is it really that simple? Are kidneys really waving the white flag?
Well, that's what we're digging into today. And spoiler alert, it's definitely not a simple yes or no. The research shows, well, a lot of fascinating nuances. Depends on your health, the type of protein, even how long you're eating that way.
Okay, so today we're taking a deep dive into exactly that question. We've got a stack of research here on dietary protein and kidney function. Our mission: cut through the noise, look at the actual science, and help you understand what's really happening inside your body when you up the protein.
Right. We'll look at specific kidney markers, GFR, albuminuria, all those terms your doctor might use. And crucially, are the changes we see signs of damage, or is it just your body adapting? Like your muscles getting stronger from a workout? Kidneys can adapt too.
All right, let's start with the big picture then. This general idea, this fear that high protein intake HPI is just inherently bad for kidneys, like full stop. What does the best evidence actually say about that for, generally healthy people?
Yeah, good place to start. The most powerful piece of evidence we have recently is a big umbrella review from 2023. Think of it like a review of reviews. Super high-level stuff.
The ultimate summary.
Exactly. It pulls data from loads of systematic reviews and meta-analyses. And what it found for healthy individuals was honestly pretty reassuring.
Okay, don't leave us hanging. What did it conclude?
Well, basically, for none of the kidney outcomes, they looked at things like kidney stones or actual kidney diseases. Did they find solid evidence that high protein intake specifically triggers them?
No trigger. Okay. But people do see changes on tests sometimes, right?
They do, but the review suggested those changes like shifts in GFR or blood urea levels were mostly physiological. Think regulatory adjustments, your body responding to the higher load, not pathometabolic responses, meaning not disease processes.
Physiological adaptation. So like you said, kidneys flexing their muscles maybe. Does that mean things like kidney stones or protein in the urine are off the table with high protein?
Well, the review suggested it's possible that stone risk is not associated with HPI, and also possible that albuminuria, that protein in the urine, isn't elevated either, at least above the standard 0.8 grams per kilo recommendation. The certainty wasn't super high, but it leaned away from HPI being the direct cause. For other markers like GFR itself or maybe urinary calcium, it was considered probable or possible that they would increase physiologically with higher protein, just your kidneys adapting. But, and this is important, they stressed we still need really long-term data, like decades long, for definitive recommendations. Most studies just don't run that long.
Got it. Need that long view. But for now, for healthy kidneys, maybe not the villain it's made out to be.
That's what this high-level evidence suggests, yes.
Okay, so let's dive deeper then. This is where it gets really interesting. What about those specific kidney function numbers doctors look at? You mentioned GFR, glomerular filtration rate. Tell us more about that.
Right, GFR, it's basically a measure of how well your kidneys are cleaning your blood each minute, filtering out waste. Normal for young adults is roughly 80 to 120 milliliters per minute per standard body surface area.
And how does protein affect that number?
Okay, so when you eat protein or even get amino acids intravenously, it tends to increase blood flow to the kidneys and also increase that filtration rate, the GFR. This is often called hyperfiltration.
Hyperfiltration. Sounds intense, like they're working overtime. Is that bad?
It sounds a bit alarming, doesn't it? But in healthy people, it's generally interpreted as an adaptive alteration. Your kidneys are just working a bit harder, yes, but it's often considered a normal response to handle the extra metabolic byproducts from the protein.
Like revving the engine slightly higher.
Kinda, yeah. But there's a mechanism behind it, too. High protein can cause increased pressure inside the glomeruli, those tiny filtering units. Interglomerular hypertension. and that can result in the hyperfiltration. So it's an effect we need to watch.
Okay, so it's mostly adaptive, but there's that pressure element. Do studies show this happening consistently?
Yeah, several studies confirm it. A meta-analysis, for example, explicitly found higher GFR with high-protein diets compared to normal or low-protein diets in healthy individuals. And studies like the OmniHeart trial saw GFR changes too. Interestingly, though, the OmniHeart researchers noted something important. When you're messing with protein intake in studies, the standard blood test, serum creatinine, can become less reliable for estimating GFR.
Why is that?
Because creatinine itself is related to muscle mass and protein breakdown. So changes in protein intake can directly affect creatinine levels, muddying the GFR picture. They suggested using a different marker, cystatin C, which isn't really affected by diet like that, might give a clearer view in these situations.
Interesting methodological point. Okay, so GFR goes up, likely adaptively. What about albuminuria or proteinuria? Protein leaking into the urine. You said the big review found low certainty, but maybe no link.
Exactly. And that protein in the urine, albuminuria, is a really key marker. If your kidney filters are damaged, protein molecules start slipping through when they shouldn't.
Right, a definite warning sign.
Yes. But again, that umbrella review suggested it's possibly unrelated to high protein intake alone. They did add a caveat, though. This lack of effect needs more study, especially looking at periods longer than 2 years.
Longer-term data again.
Always the challenge. But another study, looking at obese individuals on a high-protein diet for 6 months, found their 24-hour urinary albumin was normal and didn't increase. So, short-term, at least, it seems okay for many.
Okay, that's somewhat reassuring for shorter periods.
Yeah.
Now, kidney stones. Definitely heard that one. Protein increases the risk, right? Something about acid.
Yeah, that's the theory, and it has some biological plausibility. Protein metabolism does generate an acid load for the body to handle.
Okay.
And this acid load can, theoretically, lower urine pH, decrease urinary citrate, which normally helps prevent stones, and increase urinary calcium and uric acid, both of which can contribute to stone formation.
So, sounds like a recipe for stones.
It does sound like it. But here's the nuance again. Remember that big 2023 umbrella review? Despite the theory, it graded the overall certainty of evidence as possible that stone risk is not actually associated with high protein intake.
Wait, really? So the theory doesn't quite pan out in the overall evidence?
It seems less clear-cut than the theory might suggest. And there's a huge mitigating factor: your fruit and vegetable intake.
The rest of the diet matters.
Tremendously. Fruits and veggies are alkaline forming. They have, as the researchers put it, a marked alkalizing potential. They can neutralize that acid load from the protein.
So balance is key.
Absolutely. Even if you're eating, say, 80 or 100 grams of protein a day, if you're also getting enough fruits and vegetables, you can likely keep your urine pH in a healthy range, above 6, which helps prevent certain types of stones.
Fascinating. So for healthy people, it seems kidneys are pretty resilient. They adapt. Hyperfiltration might happen, but isn't necessarily damaging. Maybe no strong link to stones or albuminuria if the diet's balanced.
But I feel that but coming.
Laugh slightly, you know it. Because everything we've just discussed, that's largely for people starting with healthy kidneys. The story changes dramatically if there's already some underlying kidney issue. Okay, so that's the crucial pivot point. Healthy kidneys seem to handle it mostly. But what if someone already has chronic kidney disease, CKD, or even just mild kidney insufficiency? Is high protein still okay then?
No, definitely not. This is where the advice makes a sharp turn. There was a really important study, followed women for over 11 years.
Long-term data. Good.
Exactly. And it found that in women who started with normal kidney function, good GFR, higher protein intake, didn't significantly speed up any decline. Their kidneys handled it fine, adapted like we talked about.
Okay, consistent with the other findings.
But and this is the big one, in women who started with mild renal insufficiency, so their GFR was already a bit lower, like between 55 and 80. Higher protein intake was significantly associated with a faster decline in their kidney function.
Faster decline. Wow. How much faster?
About a 1.7 L amylin drop in GFR per year for every extra 10 grams of protein per day. And interestingly, non-dairy animal proteins seem to have an even stronger negative association in that group.
Whoa. That's a really clear warning sign. So if your kidneys are already compromised, even mildly, More protein is actively harmful.
That's what the evidence strongly suggests, and it's why official guidelines, like the big KDIGO 2024 guidelines for CKD, are very clear. For adults with CKD stages 3 to 5, they recommend sticking to about 0.8 grams of protein per kilogram of body weight per day.
The standard amount, basically.
Right. And they explicitly say avoid high protein intake, which they define as over 1.3 grams per kilo if you have CKD and are at risk of it getting worse. It's also why working with a renal dietitian is so critical for these folks to tailor their diet safely. There are even studies looking at low-protein diets, less than 0.8 grams per kilo, to actively slow down CKD progression.
Okay, crystal clear distinction there, based on existing kidney health. Huge difference. Now, what about the type of protein, plant versus animal? The classic debate. Does the research back up the idea that plant is better, animal worse for kidneys?
Well, here's where things get even more complicated and frankly pretty surprising based on some very recent research.
You tell.
Okay, so a huge meta-analysis came out just this year. Over 148,000 people. It looked at protein intake and the risk of developing CKD in the general population.
Okay, so this is about prevention in healthy people.
Exactly. And it found that higher intake of total protein, plant protein, animal protein were all linked to a decreased incidence of CKD.
Wait, hang on. Higher animal protein linked to less CKD developing.
Yeah.
That seems to fly in the face of a lot of common advice.
It does, doesn't it? Even specifically fish and seafood protein showed this protective association against developing CKD. So for preventing CKD from starting in the first place, this big study suggests higher protein from basically any source might be beneficial.
Mind blown. Okay.
Yeah.
But how does that square with what you just said about animal protein being potentially worse for progression in people who already have mild CKD and other studies linking it to end-stage kidney disease?
Exactly. That's a million-dollar question, isn't it? It highlights the complexity. Other reviews have pointed to observational studies, like one in Singapore, linking animal protein to a higher risk of progressing to end-stage kidney disease, ESKD. They propose reasons like the acid load, phosphate content, maybe gut microbiome changes.
So potentially protective against starting CKD, but potentially harmful for worsening it once you have it. Is that the idea?
That could be one interpretation, yes. It shows why we can't just make blanket animal protein bad statements. The context, are we talking about preventing the disease or managing it once it exists? Seems critical.
Okay. My head's spinning just a bit. But wait, you said there was an even bigger twist.
Yes, buckle up. Another 2024 study, this one focusing on older adults, 60 plus, who already had mild or moderate CKD.
Okay, so people with existing, albeit not severe, kidney issues.
Right. And in this group, higher total protein intake and higher animal protein intake were associated with lower all-cause mortality. They lived longer.
Get out. Higher animal protein linked to better survival in older adults with CKD. That seems completely contradictory to the progression data.
I know, it's wild, isn't it? Specifically, fish and cereal protein showed strong inverse associations with mortality. And interestingly, increasing plant protein over time was also linked to lower mortality in this group. But increasing total or animal protein wasn't significant in that specific analysis.
Okay, this is fascinating but confusing. So let me try to recap. Study 1 suggests high protein, any source, might help prevent CKD. Study 2, Knight et al., suggests high protein, especially animal, worsens progression if you have mild CKD. Study 3 suggests high protein, including animal, is linked to better survival in older adults with mild, moderate CKD. How on earth do we make sense of that?
It really underscores that we have to look at the specifics. What outcome are we measuring? CKD incidence, CKD progression, or mortality in people already living with CKD. They're different things. Who are we studying? Generally healthy people, women with mild CKD, older adults with mild moderate CKD. Different populations respond differently. And what's the study design? Observational studies show correlations, but they don't prove cause and effect, and they can be confounded by other factors.
Confounders, like overall diet.
Exactly. It's rarely just about the protein itself in isolation. Other research clearly shows that a typical Western diet, high in red processed meats, saturated fat, sweets, is linked to worse kidney outcomes like microalbuminuria or faster GFR decline.
Right.
Whereas a DAH-style diet rich in fruits, vegetables, whole grains, lean protein seems protective. So the package the protein comes in matters hugely. Is it a steak with fries or a grilled fish with lots of veggies?
It makes total sense. It's the whole picture.
And another big factor often tied to protein, especially animal protein, is phosphorus. Protein intake and phosphorus intake are really closely correlated. High phosphorus levels are a major problem for people with advanced CKD, linked to worse outcomes and mortality. So some of the negative effects we sometimes blame on protein might actually be driven by the high phosphorus that comes along with it, especially from certain sources or processed foods with phosphate additives.
Okay, so phosphorus is another key player in this whole complex equation.
Definitely one to consider, especially for those with existing kidney issues.
Right. So let's try and bring this all together. After that whirlwind tour of conflicting findings, what does this all mean for you, the listener? It's clearly not black and white.
Not at all. But we can pull out some key insights. First, for generally healthy people with normal kidney function, the current bulk of evidence suggests higher protein intake leads mostly to physiological adaptations, not necessarily damage. That initial widespread fear seems perhaps a bit overblown based on current data.
Okay, breathe easy if your kidneys are healthy.
But if you have pre-existing kidney disease, even if it's mild, the game changes completely. High protein intake is linked to faster progression in some groups, and lower protein diets, around 0.8 kilojoules or sometimes even lower, are generally recommended under medical guidance. That distinction is paramount.
Got it. Healthy kidneys adapt. Compromised kidneys can be harmed by too much protein. What about the type of protein tangle?
That's where it's messy but fascinating. The old narrative of animal protein bad, plant protein good for kidneys just doesn't hold up simply across the board. Recent large studies suggest higher total plant and animal protein might help prevent CKD in healthy folks, and paradoxically, higher total and animal protein were linked to better survival in older adults with mild-moderate CKD. But some studies still raise concerns about animal protein for progression to end-stage disease.
So, no easy answer there. It depends on whether you're talking prevention, progression, or mortality, and in which population.
Exactly. It's all about context. Blanket statements just fail here. And remember, it's not just the protein, the overall dietary pattern, like DAAs versus Western, and other nutrients like phosphorus and the alkalizing effect of fruits and vegetables are incredibly important pieces of the puzzle.
The science is definitely still evolving, especially with these newer, sometimes contradictory findings. But the big take-home message seems to be, context matters hugely. Know your own health status, and focus on a balanced whole food approach, whatever your protein goals are.
Couldn't have said it better.
This deep dive has certainly thrown some curveballs, hasn't it? It shows the truth about protein and kidney health is way more nuanced and, frankly, more interesting than those simple headlines let on. It really challenges us to look deeper.
Absolutely. And it's such a powerful reminder that personalized nutrition is key. What works for one person or one health goal might not be right for another. Using the best science we have, understanding your own health, and talking to healthcare professionals, especially if you have existing conditions, that's how you make truly informed choices about your diet.
Makes you think, doesn't it? How often do we just accept those quick, simple health answers we see online or in headlines? This really shows the value of digging into the research. What other health truths might deserve a closer look in your own life?
A great question to ponder.
We really hope this deep dive has empowered you with some useful knowledge, even with all the complexity. If you found this conversation helpful, maybe even a bit captivating, please do subscribe to What the Study Says and share it with anyone else who might be wondering about protein in their kidneys.
Thanks for tuning in.